Hello, good morning. This is Miss James, and I'm going to give you a quick rundown of the class. I'm going to talk about the syllabus a little bit, not going to read the whole thing, um, so that you won't spend so much time in lecture doing this. And of course, anytime you have any questions, just please feel free to give me a call or come by. See, my office is Coughlin 115. I prefer appointments because I'm also a sim lab coordinator and also teach online. So just get with me anytime. All right, so we'll be talking about women's health issues, namely during the obstetric period of their life, pregnancy, newborn, um, and that will be what we talk about the whole semester. Your course objectives, you can read those. Um, and topical outline is there of everything that we will be discussing each week. Most of your assignments will be in Moodle. I typically post my PowerPoint presentations after I get finished with lecture, so you will have those. I typically go over things in class or provide you with a study guide on how to direct your reading, because it is a lot of reading and you really do need to read for this class. We'll have lecture, we'll have some class discussion. First day of class, we're going to have like some small group activities, and there'll be more information coming on that with your teaching plans. Um, we may have some online activities. We do use ATI. I go over some things in ATI in class. And we will have simulation. Of course, you have exams in this class. Those of you who score below 77%, of course, are required to come and have a counseling session with me. I do not do full class exam reviews. You set up appointments with me within 2 weeks following the exam. If you want to come by and review, I prefer to do it one-on-one so that we can identify any problems you're having or identify any study issues that you're having or ways that I can help you with test taking strategies. I prefer to do that one-on-one. I think it's more valuable to the student, and I can help you in ways that's easier than when we have everything in class. Um, you're going to have your drug calc exam today. Of course, you score 90% or higher. If you do not, then there's a repeat. You'll have 3 exams. They're worth 100 points each. That's worth 75% of your final grade. Your final exam is only worth 10% of your final grade, and we will have alternative assignments, which are calculate to 15% of your final grade. You'll have one project. We'll talk more about that as we go in the semester. Your simulation day is going to be worth 20 points. So if you participate well and do all the activities that we have planned, then that's an easy way to get your 20 points. We have a standardized exam at the end, and you can read in your syllabus. If you score level 3, it's 4 points added to your final. If you score level 2, it's 3 points added to your final. Let's see, anything else? It's all self-explanatory. You can read all the detail in your syllabus on how your final grade is determined and what we do with our project. The reason being we found some deficits through our standardized exam of some areas that we need to focus on, and this helps you to prepare for NCLEX in those areas. Everything will be in your gradebook and Moodle as you're accustomed to. Technology is listed there. Our makeup policy is the same as from your previous classes. You really, if you could give us at least 24 hours in advance that you're going to miss an exam or you're going to miss a particular assignment, it's easier for us to be able to work with you. If you wait until the last minute, I'm expecting you to be professional, and I'm expecting you to consider this as like a job. And what would you do as your job if you were going to be late? What would you do on your job if you were going to miss a deadline? It's what we're trying to develop, our professionalism and our leadership skills, and that's all part of it. I expect you to honor your due dates. We use only our LSUA email. I will not be emailing you to your personal email account. We do all of our emails through Moodle. And so I would expect to be receiving emails that way. And I expect you to observe email etiquette. My name is Dr. James. It's not hey. And you greet me as Dr. James. I would like to talk to you, or Dr. James, I'm sorry, but I'm going to be late. Or if you have a question about something, you don't just start off telling me what you want or what you need. We practice while we're here so that whenever we do get out into the working world, we address people professionally in the way we should. All of your contact information is there in case you need any services. If you require accommodations, remember you obtain those letters from Student Services every semester, and you provide Mr. Peters and myself with your letter from Student Services if you require testing accommodations. Drop dates are listed there. Your required textbooks. If you have not paid your second installment to ATI, you will not be able to get in, and it is a requirement. You will not be able to get into your proctored exam. We will be looking at our rosters and make sure everyone is there. All of your previous textbooks, all of your previous resources, those will be required for you to refer to. They aren't listed here, but everything that you have from previous courses, you're building on that knowledge. We won't be repeating a lot of that. You'll be expected, if you aren't sure of something, you'll be expected to go back and look at those things. All right. We do expect APA format in your written work, so make sure you follow that. Okay, I'm going to go over your clinical syllabus now. Clinical this semester, some of you will be at clinical on Thursdays, some of you will be in clinical on Fridays. Ms. Cruz, our nurse practitioner at Cabrini, she will be your clinical instructor. And you can also consult with me if you're having any issues in clinical or any problems, and the two of us will work together to work it out for you. All of your OB clinical will be at Cabrini Hospital. It is a very interesting model that's used there. Mothers labor, deliver, and care for their babies all in the same room. It's a very good model, and we've had Miss Cruz teaching with us for many years, and I think you'll enjoy being with her. You will gain experience in not only labor and delivery and seeing the birth of a baby, both vaginally and by cesarean. You'll also learn how to take care of a newborn baby and how to take care of a mother during the postpartum period. Remembering we're generalists, we can't get into the very critical aspects of this area, because if you choose to go into the obstetrical area or into the newborn or even the NICU area, it is specialized training that takes a lot longer after you get out of school than what we can do in one semester. Prerequisite, of course, is that you've completed everything and you've gotten a C or higher in all your previous courses. As you know, clinical is a pass-fail, but you can receive unsatisfactories in clinical, and after you receive at least 2 unsatisfactories in clinical, you could run the risk of failing the course. You can read your objectives there and what our topical outline is, what we'll be doing. Of course, Our evaluation methods are what you do in clinical, how your performance is. The more interested you are in clinical, the more interested you are with the nurses and ask questions, the more opportunities you'll have. The more you sit in the lounge or sit around the desk and you aren't getting up and engaging with the patients, the less the nurses will be willing to work with you, and the less you will learn from this semester. You will have post-conference activities. You will have expectations, which are listed out in your appendix that I've posted in Moodle. You will have a little checklist that you will keep with you of the different skills that you are able to do while you are in the clinical setting. The more available you are, the more opportunities there will be there for you. Ms. Cruz will be evaluating you on a weekly basis, the same form that you've been accustomed to in clinical. You will use there of the different things that you have seen, different things you've done. You'll also have a clinical reflection that you're expected to do each week. I will spend some time meeting with you on the various paperwork. We have simplified it quite a bit for this semester. The only things that we're expecting you to type are your clinical reflection and your concept map. Your concept map is like what you did in psych, and it's your care plan. And once you turn in one good concept map and it's satisfactory, then you won't be required to do another concept map for your clinical experience. But we do want a clinical reflection. It's the same form that you're accustomed to, one for each week. Even if it's an orientation week, we still want you to reflect on what you learned for that week. Identify what your strengths and weaknesses are. Identify how you collaborated with the staff or with a physician or with respiratory therapists. And collaboration is more than delivering meal trays to the client. Yeah, we will be doing that, but we're a step ahead now. We're not in fundamentals. We're not in MedSurg 1 anymore. What did you see on a fetal monitoring strip that you might have gone and talked to the nurse about? What did you find when you took a blood pressure and you felt it was high and you went and talked to the nurse and you looked to see what was going on with the client? Was she in pain, or was she spilling protein in the urine, or coupling the high blood pressure or something you see on a fetal monitoring strip with what's going on with the mom at that time? That's collaboration, to look at what's going on and making a plan on a possible intervention for the client. What were some safety issues that we saw? We see a lot of them in the labor and delivery. A lot of times people aren't wearing gloves as they should, or they're dropping things on the floor. So make your clinical reflection valuable. You can finish reading all of the things in about our OB project. Your project is based on what you do in clinical, but you will receive credit in theory for your project, and we'll talk more about that. Policies are the same. You are expected to be at clinical, just like you're expected to be at work on time. If you are more than 10 minutes late, depending on what your reasoning is, depending on if you have notified your instructor, depending on if you have notified according to how your instructor wants you to notify. Some want you to call the unit, some want you to call or text them and let them know that you are not going to be there or that you're running late. Depending on the instructor, you may get sent home for the day with an unsatisfactory. We expect you to be on time. We expect you to be in clinical dress, which is following the dress code policy for LSUA. If your hair's on your collar, it needs to be pulled back. No jewelry at all, not even any studs in your ears. No piercings, tattoos covered. Uniform needs to be pressed. It does not look like you slept in it. And yes, I have had clinical students show up in uniforms that they have slept in because they didn't want to lose any sleep getting up. Um, if you have a long commute, let Ms. Cruz know. Um, because if you're running late, sometimes it's relational to weather, to fog, so you need to tell her. Whenever we have sometimes weather days, we're at that time of year that sometimes we have a weather day, you will have clinical makeup work to do. Now, even though sometimes you're sick and you are allowed one clinical day to miss, it does not mean that you do not get clinical makeup work to do. You may get an extra day going to clinical, or you may get extra paperwork to do that it equates to the number of clinical hours that you have missed. It's very important to stay in very close communication with not only your clinical instructor, but also your course coordinator. We follow the chain of command. If you come to me about an issue you're having in clinical, my very first question I'm going to ask you is, have you talked with your clinical instructor first? Because I'm not going to talk to you about the situation until you have talked about the issue with her first. Your drop dates are on there. Textbook requirements are the same. I have included as many resources as I can for you to refer to in your appendix. As I said, we have simplified paperwork quite a bit this semester. If your handwriting is legible and Ms. Cruz can read it, you can write your clinical documents in pen. You're expected to do your clinical paperwork and turn it into her. Say, like, you take care of a laboring client this week. Next week on Thursday or Friday, whatever your clinical day is, then you would turn your paperwork in to Ms. Cruz that day. Concept map, though, does need to be typewritten. That's your care plan. Your reflection for the week does need to be typewritten. But your labor and delivery assessment, if you carry for that client this week, that can be handwritten and turned into her. With your jot sheet, you'll be given a jot sheet. It's like a report sheet. You need to turn that in to her each week so that she can have something documented what you did. So this is how your paperwork goes. You're going to go to clinical, say January 17th. You'll be assigned to a postpartum client that day. So you will do a postpartum assessment, a clinical reflection, and a concept map. With your postpartum, there's a list of common lab results and the instructions on there how to fill it out. You will, hopefully, you get 3 hours of clinical prep for each week. You have a list in your clinical expectations of medications that you can do your drug cards ahead of time. It does not matter to us if you bring cards, if you print off the pharmacy stacks out of ATI. Some way, somehow, you need to bring your medication report with you of all of those drugs, because the drugs that you administer, we will expect a drug report. Now, a lot of times there are drugs that are not in your list. Now, those you will be expected to look up and be ready for your drug report. We will expect you to have already looked at your MAR of the patient, that's your medication administration record, be able to tell us what medicines you have due and what time, and manage your time in that regard. You will be expected to take vital signs. You will be expected to make beds, give baths, all the things you've been doing prior to coming to clinical, along with doing some more things that we'll be expecting you to do. If you're assigned to a laboring client, you'll have a labor and delivery assessment that you will do. If you, sorry about that, if you're assigned to take care of a baby, then you'll take care of the well baby checklist for that day. But always, if you have any questions, feel free to ask me, because it's a lot. It's a lot of papers to look at, a lot of expectations. OB is something different than anything you've done in the past. So I'm ready for any questions you have, any problems, any confusion. Just let me know. Um, and I hope you have a great semester. Listen to this video, look over your syllabus, and make sure you look at your handbook. It is there. You will be expected to know its contents, and go ahead and sign off on your little academic integrity quiz that's posted in Moodle, so everything will be done as we begin this new semester together. Hope you have a great day.